if one has risk factors to heart failure, could be your family, genes, can't do much about that. Heart failure, briefly, is the failure of the heart to do its job. Our job as doctors is not necessarily to make someone live longer, but have a good quality of life. Welcome back. Thank you guys for all the support and the love you've shown me in the past couple of days and weeks. We are on our second episode.
Yeah.
Supported hugely by Creative Replay.
It's good to be back.
Mashimane. Thank you very much for the support, and more importantly, to the people who listen to us. Remember, the reason why we're doing this podcast is just to debunk some of the myths and to empower people within the confines of the spaces that I think I know best. So I appreciate the feedback, things that you'd like us to talk about in the future. So last time we spoke briefly about the heart and the devices. Briefly spoke about valves, axion inhliziyo yewashi. We spoke about the pacemakers, stents, and all of those other things. Today we're going to touch on another subject that's probably equally important and becoming more prevalent as we get older. I keep saying to the Creative Replay boss, if you pray for the rain, you can't complain about the mud. So what happens as we get older in the cardiovascular medicine, we start getting certain conditions that will affect you, the loved one, but almost surely by the time 65, 75, you know someone who's had either heart failure, cardiac arrest, a heart attack. So today we want to talk briefly, what are the differences? Are these the same conditions? Heart attack, heart failure, cardiac arrest. All right.
Yeah. I think those are so good.
Yeah.
I love being on this side because we were just saying, Witty, I'm literally a student in real time. And having the conversation between us is you speaking to your audience, because I thought it was the same thing, to be honest.
Yeah. Well, so if you think about the heart, it's nothing but a pump. It's a muscle. But unlike any other muscle, it responds to its own electrical activation. So it's muscles with the nerves, right? So when one gets damage of the heart muscle, it's not uncommon to get a damage of the nerves that supplies the activation of the heart. So let's start with probably the most common one, heart failure, all right? That's when the heart doesn't do its job properly. There are different nuances of heart failure where the heart is not pumping well or when the heart is not relaxing. But most familiar term when we use heart failure, we mean the heart has inability to pump the adequate amount of blood to supply the body. That's it. So it's not pumping well. You often hear doctors talking about ejection fraction. We're not going to get to the details about that, but when the ejection fraction, that means the surrogate we use to see if the heart works well or not, is not doing well, right?
So if I may ask, when you speak about heart failure, does it happen in a process of time? Do you see it coming? Or does it just fails, just out of the blue?
It's everything. So, for instance, if one has risk factors to heart failure, could be your family, genes, can't do much about that, obesity, diabetes, hypertension, previous heart attack, we'll come back to heart attack, you can see some progression to it. But sometimes it's instant. For instance, once again, heart attack may give you immediate heart failure. You've been good, and then you get a viral infection that affects the heart, inflammation of the heart muscle, myocarditis. Muscle gets tired, muscle gets weak, sudden. So some are sudden, but most of them are insidious. They come over a period of time. How come we don't get to see? It's because we get used to how we feel. And we're quick to say, I'm unfit, I'm getting older, but you're actually having heart failure symptoms. And by the time you get to a doctor, you probably have had these symptoms for a considerable period of time.
Sure.
Could be years, could be months. Yeah.
That's so good. I'm thinking, so it sounds like, I might be wrong, heart failure is the end result of a cause or something happening within the heart, or?
Yeah, so the most common causes, like I said, could be family, genes, familial. It runs in the family. For instance, if you're 25 years old and your sister had heart failure for no apparent reason at the age of 38, at the age of 45, probably runs in the family. If your other sibling has it, almost certain that it's in your family. You can't ignore what happened to your blood relative, particularly a sibling or your parent. All right. And then there are obvious stuff, hypertension, diabetes, all those are still the most common cause of heart failure. And then in places like Africa, subcontinent, in maybe India, infection called rheumatic heart disease that affects the valve, still one of the most common causes of heart failure. Yeah, most of the time are things that can be prevented or treated, but it ends up in heart failure. So heart failure, briefly, is the failure of the heart to do its job. That means not pumping adequate amount of blood into the rest of the body. That's heart failure, all right? It carries a very, very poor prognosis, meaning that most people left unchecked, left untreated, most of them would have perished in the period of about 5 years. Worse than most cancers. Absolutely worse than most cancers, unfortunately. The good news, there are so many things we can do these days about treatment of heart failure.
That's
It's
encouraging.
Yeah, that's another topic. But the pillars will be medication, pacemaker, defibrillators, artificial heart, heart transplant. But obviously, some of these things are pie in the sky. But we'll talk about heart failure management some other point. But the good news is that there's quite a lot we can do in 2025 to make a patient feel better, because really our job as doctors is not necessarily to make someone live longer, but have a good quality of life. If that is intertwined with longevity, that's great. But we just want people to have better quality of life. But we'll talk about that under heart failure management.
Yeah.
But the good news, we can do quite a bit. So this was heart failure. Any
That's
questions?
good, yeah. No, I think that's insightful. I think for me, the easiest explanation is understanding that heart failure is, or maybe the way I'm explaining it, that it's within the process of something else maybe going wrong that causes the heart to fail, maybe. And then and failing is the inability for the heart to do what it does best.
Yeah. How do you know if you've got heart failure briefly? Undue fatigability, things you were able to do, walking up the stairs, you can't walk up the stairs. Walking fast, you can't walk fast. Suddenly, you've got swelling around the ankles. Suddenly, you need more than one pillow, or you now need a continental pillow to sleep on. Waking up at night, choking, short of breath. Those are the most common symptoms of heart failure.
Sure. Right. I'm using 2 pillows right now.
Yeah, but remember, these symptoms are never specific to a condition. You could have all these symptoms and you're suffering from something completely different. Could be a lung disease, could be kidney disease. But I think the point, what we're trying to say, don't ignore that combination of symptoms. Sudden shortness of breath, inability to do things that you were able to do a couple of weeks or months ago, swelling of the legs, inability to lie flat, needing more pillows, prone up, waking up at night, sudden shortness of breath, almost as if you're having a bad dream, Heart failure.
Yeah, that's good. That's good. I've just learned a lot. After this, guys, I'm going to have a PhD. That's all I'm saying. And hopefully all of our listeners will get to work on this journey and learn just as much. And then we go into cardiac arrest. Now, I think of the word arrest, like the normal term in the way in which it's used, it means that you are bound, you can't exactly move. I think if I understand it correctly, if you say I'm putting you under arrest, it almost speaks about that.
Yeah.
Would this apply? Is that how the word?
I never thought of it that way, but it makes perfect sense. So cardiac arrest is an electrical disorder. So we just spoke about heart failure, which is a muscle disorder. Heart has got muscle, heart has got nerves, right? So every heartbeat that we have is as a result of the nerves of the heart stimulating the heart, right? 50 beats per minute, 100 beats per minute, all could be within normal for that particular individual, right? But suddenly, let's say on average, your heart rate is 75 for no particular reason, and it shouldn't be. Your heart rate goes to 200, goes to 300, and gets to a point where the body cannot sustain this very fast, chaotic heartbeat, and it becomes a flat line. So the heart speeds up in a very abnormal way, in an unnecessary way, in an unwanted way, goes extremely fast, 300, 400, and the heart can't maintain that and then goes into a flat line. Medical terminology will be what we call ventricular fibrillation. Once again, we'll come back and dissect all these topics. But cardiac arrest, it's a sudden inability of the heart to move at all and pump blood. And it's usually as a result of an electrical disorder. Heart has got nerves. Nerves give electricity to the heart. It's an electrical disorder. Now, you probably have seen in the movies when someone suddenly collapses, right? Or on a soccer pitch, or on a basketball pitch. Elite athletes, has been training for years, pristine condition, and suddenly collapse, right? It's sudden, it's painless. Those who survive usually don't have much recollection, all right? So we've seen that unfortunately, happening and taking lives of relatively young individuals. People go to bed at night and never wake up. That's almost always cardiac arrest, right? So it's a heart suddenly stops beating, but it's usually preceded by a heart going very fast. So that's cardiac arrest. Maybe looking at the way you explain it, and I've never thought of it, it's yes, you're arrested, you can't move, can't do anything. Yeah, the heart can't do much, and it stops.
So what usually, it sounds like, for the lack of a better word, a malfunction. Like, like electric door, and it just starts banging, opening and closing. Now I'm thinking about the 200 beats per minute, because that's a lot.
Yeah, actually, it's usually more than that for you to get to cardiac arrest.
So is that a result of something? Is there a chemical imbalance? Is something else causing the heart to do that? Is it a response?
So common things will prevail. So, for instance, a young athlete, been good, went through some medical examinations. If it's not looked after by a specialist person, even under those circumstances, it's extremely difficult to predict who's going to have cardiac arrest. Right? Because it's not something that you can see all the time. There may be issues when you do what's called imaging of the heart, ECG of the heart, or in the US they call it EKG, ECG, where you can say, oh, you are at risk. But sometimes all those things are completely normal. It's something that is sudden. So genetics play a big role, particularly among sports people. One of the most common causes of cardiac arrest is heart failure. Advanced heart failure can give rise to cardiac arrest. So they are not mutually exclusive, these conditions. You have an advanced heart failure, you may perish because of the cardiac arrest. Someone who's had a heart attack may have cardiac arrest. Someone you mentioned electrolytes imbalances. Say sometimes you get these patients who've got poor kidney function and they undergo what's called dialysis. If their potassium is very high, maybe they're taking drugs that make the potassium go high. They're taking fruits like bananas that make their potassium go high. That can also cause cardiac arrest. So it's a multifactorial, but I would say common things will be genetics, heart failure, heart attack causing cardiac arrest. Now, cardiac arrest, like I said, that's probably the best way of dying if you're going to die. It's sudden, it's extremely quick, pain-free. But obviously those left behind, they feel that they never had a chance to say goodbye, whatever it is. The best way to treat cardiac arrest, or the only way, is to jump on somebody's chest and pump. And if you've got defibrillators at the airport, the sports field, now they advocate that you must have these defibrillators pedal someone. So those are basically two best way to have a chance of reviving someone.
That's good.
You've probably seen in movies someone suddenly collapses and they pedal them back.
Yes.
Yes. That person has had a cardiac arrest.
Now, you keep mentioning sports, and I'm just thinking about it just for myself with my brain, Luguti. Is it possible that this cardiac arrest is something, let's say, like you're saying, it could be run in the family, etc. Is it possible that it's underlying, but a certain activity you do brings it up? So some people live with it for a long time, but because of the activity, it doesn't necessarily, bring it up.
Yeah. Okay. I'll answer you in an indirect way. We always, as physicians, want patients or people to be active. So to exercise is good. Yeah. Unfortunately, some of those people are at risk, when they are involved in sudden movements, extreme activity, then they can have cardiac arrest. So yes, it's true. Certain things are triggers, like extreme exercise during the intense game.
Can stress be a trigger?
Yeah. Huh?
Stress.
I never know about stress.
something
Because you look
traumatic
around
or
and say, who
something.
doesn't have stress? And then can you really pinpoint stress to anything? Probably everything and anything. So it's up in the air, and yeah.
That's good.
Yeah. But physical activities and all those other things that you mentioned can, cause cardiac arrest.
That's good. And then...
So once again, long-term treatment of patients who've had cardiac arrest usually, unfortunately, means that they're always at risk. If one has a stroke, there's a very good chance that they will die of a stroke. If you have heart attack, chances are you're going to die of heart attack. So if you've had one cardiac arrest for something that usually is not recognizable so that it can be treated or cured, chances are you're going to have another cardiac arrest sometime in your life. And therefore, we feed these people with defibrillators inside that is implanted just below the collarbone. So they walk around almost with their own emergency room. Right.
Oh, that's so good. So they have their own, that thing that shocks them there.
Yeah. I don't know how much, I'm a big soccer fan. So one of the most disturbing scenes was a guy called Mark Vivian Four, Cameroonian guy who died on the pitch, playing for Cameroon. He used to play for Manchester City. Then there was another one, I think, Mwamba. Mwambi is also a guy who survived. Fortunately, also collapsed on the pitch. I think they were playing Tottenham. I can't recall what team was he playing for, but they're playing Tottenham.
Sure.
So it can be very disturbing.
No, I'm sure for everybody who's around, it's not something, it's not normal.
Yeah.
And like you're saying that for your loved ones, that opportunity of feeling like, I didn't get a chance to say goodbye, etc. I think can be challenging for those that are left behind. But also over a process of time, I've also heard people say, hey, at least they didn't experience any pain, and so forth, because...
Yeah. Just a note on cardiac arrest. I mean, one of the things that we hear about is that someone went to sleep and didn't wake up. Right? If they are under the age of 40, probably it was primarily cardiac arrest. If they are over that, in particular, maybe if you are 65 and above, they probably had a heart attack that caused cardiac arrest. Remember, I said heart failure can cause cardiac arrest. Heart attack can cause cardiac arrest as well. But generally, cardiac arrest won't cause heart attack, or cardiac arrest won't cause heart failure, right? So if you've had a family member, mom and dad, particularly your siblings, if they are young and never woke up, you need to go and check yourself because it could be running in the family.
Sure. I guess
we'll come back to that in terms of treatment.
Yeah.
Just wanted to define simply these three common things. So we've spoken about heart failure, inability of the heart to do its job, to pump. Cardiac arrest is an electrical disorder. Heart failure is a muscle disorder. Cardiac arrest is an electrical disorder.
Now the one that I think we all at least know this one, a heart attack.
What do you know about heart attack? Creative replay. Like if
you see, now it's becoming tricky now that you're explaining everything. But for me, it's television. That's how we learn these things. All I know is that if I have to look at the word itself, for me it sounds like an attack on the heart.
Attack
Attack
by
on the
what?
Now, if I have to think, a
Yeah.
virus, no, of some sort. No, but I don't know. well, a biological virus. Yeah.
So heart attack, it's a plumbing problem. So we spoke about the muscle problem, heart failure. We spoke about an electrical disorder, cardiac arrest. Now we're talking about the plumbing issue. So the heart has got muscles, it's got nerves, it's got blood vessels.
Okay.
Yeah. So the heart has got major blood vessel supply, major. It needs oxygen, a lot of it, right? So it's got its own blood supply, like any other viable organ, right? So we've got major blood supply. If any of those blood vessels clog up, close up, collapse, get damaged such a way there's not enough blood flowing through that vessel, obstruction basically of the blood through the vessel, that is heart attack. It's usually preceded by certain symptoms. Once again,
That's why this
not
whole
specific.
cholesterol thing.
Chest pain. Now, quickly on chest pain, we all have had some sort of chest discomfort, right? Let's start with the ones that are less likely to be heart attack, but it's a chest pain. Poking pain, sharp pain. And usually when we ask patients about these things, so we also pay attention to the expression. So we say, where is the pain? And if they take a finger and point, we almost certainly know that that's not heart attack kind of pain, because heart attack kind of pain is usually dull over a larger area on the chest. So if someone, they say, where's the chest pain? And they open up their hand, you sit upright and listen to them more attentively, right? If they take a finger and say, you can start thinking, what I'm going to have for supper today. Oh, I need to go to the gym, because when you can point and say the pain is right here, that's usually not heart attack. When you put a hand over your chest and say it's here, ill-defined, we pay attention. Number two, if someone says it's dull, it's like someone sitting on my chest, like an elephant on my chest, we pay attention. Also, we pay attention to someone who's never had indigestion before, and you 45, 50, you smoke or you're diabetic, and suddenly you've got indigestion for the first time. Could be a heart attack, right? So yeah, those are kind of things that make you think, okay, this is heart attack.
Can a heartbreak give you a heart attack?
The heartbreak can give you a condition that can give you cardiac arrest, can give you usually reversible heart condition called Takotsubo. It's a Japanese name, but actually it's a real thing that if you've got great emotional changes, could be too much happiness, could be too much distress, you get what's called Takotsubo. We'll talk about it some other time. But the emotions, very good, very bad, you can get a sudden heart condition, Takotsubo. But today, we just want to confine ourselves to heart failure, cardiac arrest, heart attack. So let's go back to heart attack. It's a blockage of these, they're usually three major vessels, right? If one of them is blocked, then someone gets a heart attack. But it's usually preceded by pain that people ignore. That kind of chest pain that I was describing, usually emotions, happiness, sadness, shouting, anger, physical movement can bring on that chest pain. When you rest, the chest pain goes away. It's usually for like maybe 2 minutes, 5 minutes, not that long. If someone comes to you and says, Doc, for the last month, I've got this chest pain that is there for 12 hours or whole day, and they're still walking around and probably they're not having angina, So it's a kind of a chest pain that usually when they describe it, okay, this person is having what's called angina, which is precedes most of the time heart failure. If you ignore that, heart attack. If you ignore that, then you may have full-blown heart attack. Now, there are traditional risk factors. Sorry, you want to say something?
No, I'm thinking about the word heart attack and how does heart attack link to cholesterol? Is that why cholesterol is a big thing, or is that different?
Now you put me in a big spot now because there's divergence of opinion among lay people and unfortunately among doctors themselves. Traditionally, I'm going to talk about traditional mainstream. Yes, there is a link between high cholesterol causing plugs in your heart to give you a blockage. Yeah. Actually, let me correct myself. That the problem are what you call statins. There's a group of drugs that treat high cholesterol, and high cholesterol is linked to one of the reasons why your heart vessel may be blocked. Statins. We'll talk about that some other time because it's another conundrum. It's a big issue, pharma issue. Other people believe in it, other people don't. We as Western doctors, most of us believe in it. Doesn't necessarily make us right all the time.
Okay.
Yeah. So yes, one of them is high cholesterol, hypertension, high blood pressure, diabetes, smoking, family history, particularly if your mom had a heart attack or angina under the age of 65, your father had heart attack or angina under the age of 55. Women tend to be a bit more protected. So if you go to a heart attack ward, it's mainly men. Right?
It's the stress.
Yeah. Well, women have got cholesterol. They tend to maybe take better care of
themselves.
I don't know if that is true. But cholesterol estrogen has a role to play. So women tend to get heart attack a bit later than men. But also, I think, I don't have the numbers, I think more men smoke cigarettes more than women, I think. I don't know if that is entirely true.
I think that's true.
So smoking, your genes, hypertension, diabetes, cholesterol, those are traditional risk factors. Of course, there are other ones.
Just for my own curiosity, you mentioned smoking. One would think smoking is more about the lungs. And then how
smoking
does
about everything, even how your skin looks, skin lesions, lungs, vessels, gastrointestinal, it's basically everything. It's probably one of the worst things that ever happened to humankind. And unfortunately, the smoke industry for years spent probably billions of dollars trying to hide that information from us, that smoke is bad.
I wonder if vape was also going to have, or is having
Vape
the
is
same...
bad. Maybe not as bad as cigarette, but nothing good about it. Absolutely nothing good about it.
Sure. So a heart attack can lead to heart failure because
Yes.
of the clogging of
Yes.
the... Okay.
Yeah. So heart attack, because of the blocked vessels, get heart attack. And then if one damages enough muscle mass, then they can end up having a heart failure. So you've destroyed enough muscle such that there's not enough muscle to pump the blood, then heart failure.
And
but
then
generally, heart failure doesn't cause heart attack.
heart attack. And then can a heart attack be treated by the different devices that you mentioned, or is the treatment process completely different?
Also, if you want to cause it device, so the major one will be putting what is called a stent, stent. It's a stent is like a mesh wire that you put it inside the vessel and dilate it. So my colleagues who call themselves plumbers, they're experts in that. I'm an expert in the electricity part of it, cardiac arrest. Yeah.
That's good. Now it makes sense. I remember the one time we were at the hospital. I thought I was understanding it, but I understand it better now when you introduce me to some of your colleagues. And you're like, I'm the electrician, he's the plumber.
Yeah.
But now I understand what you mean by that, because electricity is in the nerves.
Yeah.
And in the plumbing, obviously, I can think
Blood
of
vessels, something to do with the fluid movement, right?
Yes,
Plumber.
yes.
So blood movement, inability of the heart to get enough oxygen through the blood volume, blood supply. That's a plumbing issue. So you ask about the devices. The device, if you want to call it a device, a stent, Obviously, if that doesn't work, then a bypass, where you then have open heart surgery.
And you obviously don't necessarily do a lot of open heart or any open heart surgery.
Yeah, no. So open heart is mainly for surgeons. The surgeons, yeah. So cardiologists will do what's called closed heart surgery, or we don't really use the word surgery, but sometimes people feel it's semantics. We call it procedures, minimally invasive compared to opening up someone's chest. Yeah, but sometimes you don't have a choice. It just depends how bad or not so bad your blood vessels are.
And then for heart attacks, do you find that it's usually patients from a certain age going up?
Yeah, so these are usually diseases of lifestyle that leads to heart attack, that may lead to heart failure, that may lead to cardiac arrest. So an arbitrary number would be like 40 and above. You start having this risk coming up where you may have any of this. But let me walk you back. We spoke about elite athletes, 27, prime, going through medical examination before they join a particular team, cannot or may not be detected. So that's not age related, that's genetics. So part of it is age, mainly heart failure, heart failure, heart attack, but cardiac arrest can be any time of your life. It's usually genetics. But once again, another component may come from the fact that you've got such bad heart failure or bad heart attack that leads into a cardiac arrest.
Sure.
So if you were to simplify
Yeah.
and summarize, one is a muscle problem, inability to do its job, muscle problem, heart failure. The other one is an electrical disorder. The heart beats way too fast, cannot sustain that, and stops. Electrical disorder, cardiac arrest. The other one is a blood flow problem. The heart cannot get enough blood flow, therefore extract oxygen. It's heart attack.
I think the way you've explained it, guys, I'm getting my PhD. That's all I'm saying. No, but thank you for explaining it, because then now we're getting more educated with regards to understanding these things. Like, all of it was a heart attack. As soon if it touches the heart and something's wrong, it sounds good. It's a heart attack.
Yeah.
And these fancy terms that we'll call fancy, I think we're above, because we just classify everything as a heart attack, or maybe just, I don't think a lot of people even say cardiac arrest. You know, we see that in the series and movies that you watch, but now we have an understanding, and we also know that these things are curable. They are treatment process treatable. Sorry, treatable is the word. Yes, also understanding that they exist, but there's also procedures, and they are treatable. So if anybody who's watching or listening may feel symptoms, or they know a family member and so forth, at least they now have some form of understanding to say that, no, man, this is treatable. Let's get our test done.
Yeah.
What would be the method, actually, if you feel you have that, or you know somebody in the family and so forth?
So I think when it comes to these three conditions we spoke about today, cardiac arrest, if you survive it, or your family members had a cardiac arrest, heart failure, heart attack, it's to see a cardiologist. Where you may not be able to see a cardiologist because of where you are at, if it's possible to get an ECG, that would be probably one of the best things you can do for yourself. And echocardiogram, the ultrasound of the heart, which shouldn't be difficult in urban areas, but obviously if you're in a remote place, it becomes extremely difficult to get this. But those are the two basic investigations in the absence of the cardiologist. If you can get echocardiogram, which is the ultrasound of the heart. Ultrasound of the heart, just think about it when you do ultrasound in a pregnant woman. You're looking at the baby, size of the baby, the weight, and all of that. When you do the ultrasound, we look at the heart muscle, how they pump, how they're formed. Is everything that we can visualize normal, right? And then ECG on the other side tells us about the electricity of the heart. All right. So the echo will tell us if someone is having a heart failure. ECG tells us about who has had a risk, who has a risk of developing cardiac arrest. Having said that, it's not always the same. Today, your ECG may be different from the ECG you did 12 months ago. Yeah.
Sure. Doc, I think that was good, man. What an interesting topic. I think that would be a good segue to say that if people have any questions from what we've discussed, for them to just put them in the comments.
Yeah.
Let us know so that you can also answer those questions. And maybe you find that some questions are so important that they can turn into an actual episode.
Yeah. So even management of these conditions, they differ. It's not the same how we manage them. But the good news is that we can do quite a lot about these conditions in 2025. It's unfortunate that the way we practice medicine in South Africa, it's dependent on who you are, your earning power, which is why most of us are excited about the possibility that you may have national health insurance. How it's going to be done, that's a different topic. But I think we can't have a situation where only a handful of people can access relatively good medical services. Which brings us maybe to our next topic and to medical students.
Yeah.
You want to be a family practitioner, aka general practitioner, or you want to be a specialist for the other episode?
I think that's going to be a very interesting one because then we got to understand the difference and the pros and cons of that.
But of course.
Well, episode 2, it's been good. Really excited for the third one.
Looking forward to the comments and hopefully it brought some clarity to a lot of individuals. Remember, there are no specific symptoms, right? So you know your body. If you feel unwell and you think it's a heart, the least you can do is to consult someone. And if you can be in a position to get ECG, bare minimum, and ultrasound of the heart, most of the time you'll have some sort of clarity of what's going on.